Good evening, my friends. Welcome back to Sayan's Micro Classes, episode 14. Keep liking, subscribing, and commenting on my videos. Today, I'll speak upon a very important topic and discuss with you also. This is regarding the so called black fungus and white fungus that we see so much about in newspapers or media or news channels also. Now, actually, in this COVID situation, the infections by these fungi are also becoming very important. Now, black fungus is not at all black fungus, it is a white fungus only. It's a mold, accepted hyphae, order Glomeromycota or phylum Glomeromycota, and it's of maybe of three types mainly: Rhizopus, Absidia, and Mucor. So it is a type of mucormycosis. So there are only grayish to blackish spores that are visible. So people are calling it black fungus, but it is not black fungus. Black fungus is something else, like this Coledotrichum or Alternaria or Gonidiobolus. These type of fungi. These are not important here. Now, why this mucormycosis occurs in COVID? Maybe because of uncontrolled diabetes or diabetic ketoacidosis that is mostly found in the COVID infected patients, or it predisposes one to develop COVID. It may also be due to the long term use of steroids like dexamethasone or prednisolone, which suppress the immunity. Now, as regards the white fungus, it is a yeast, Candida albicans, and it can cause different types of infections like mucocutaneous infections, oral thrush, and other infections, intravascular infections or bloodstream infections also in case of neutropenia and steroid use. Now, what to do in case of suspected mucormycosis? The signs and symptoms will be proptosis or diplopia or nasal discharge or blackish granules from the nose. It mainly enters through the nasal mucosa and then that can very rapidly go to the cavernous sinus via the ethmoid bone if one is diabetic or uncontrolled diabetic. So one has to be very careful about it, and if these signs are there, then one must report immediately to the doctor, like diplopia or nasal discharge or blackish granules arising from the nose, widening of the bridge of the nose, these things. Now, these should be managed immediately with liposomal amphotericin B or posaconazole. Voriconazole should never be used, and there should be development at this point of time of diagnostic mycology lab, and there should be widespread availability of liposomal amphotericin B and other drugs. As regards candida, it is much less dangerous than mucormycosis, and it can be managed well by azoles, both old azoles like fluconazoles and new azoles like voriconazole, and other drugs also. So please be safe. Do read more about these fungi, and keep liking, commenting, and subscribing to my channel. Namaskar.